Hello class, my name is Oscar Paz for HIN 5301. The title of the reading I'm presenting is Can Electronic Medical Records Systems Transform Healthcare? Potential Health Benefits, Savings, and Costs. Overview of the presentation. I'm going to start with an introduction, then talk about the methods used by the authors, other industries, potential efficiency savings, potential safety savings, potential safety benefits, and the costs and net savings associated with electronic medical record adoption. The authors began the paper by pointing out that most medical records are stored on paper, which means that they cannot be used to coordinate care, routinely measure quality, or reduce medical error. At the time the paper was published, the authors believed that widespread adoption of electronic medical records would lead to healthcare savings, reduce medical errors, and improve health. These are the aspects that the authors explore in this reading. Methods used by the authors. To estimate current health information technology adoption, the authors used the Dorenfus survey by the Health Information and Management Systems Society, or HIMSS. To estimate potential HIT efficiency savings, the authors surveyed peer-reviewed and non-peer-reviewed literature. To estimate cost of adoption, the authors used information from literature and information directly from hospitals. They included costs such as one-time implementation costs and maintenance costs. To estimate potential safety benefits, the authors used databases that contained computerized physician order entry data and used this data to extrapolate safety benefits. To estimate potential health benefits, the authors considered disease prevention and chronic disease management. To measure these effects, the authors used the Medical Expenditure Panel survey. In the papers, the authors look at how other industries performed with information technology. The authors say that some industries who invested in IT in the 1990s saw a 6 to 8% growth in annual productivity, some of which can be attributed to IT. This graphic on the right shows what the authors believe would have been the decrease in annual health spending with IT investment in healthcare. The top line is a projection of annual health spending. The middle line is the effect of 1.5% productivity improvement that could be attributed to IT. And the bottom line is 4% productivity improvement that could be attributed to IT. After evaluating other industries, the authors state that the most savings will be related to the amount of change that occurs with health information technology. The authors estimate a $77 billion savings per year if there is a 90% adoption of electronic medical records. This chart on the right shows the potential savings that can come from different categories. The highlighted items show that the highest potential savings come from reducing hospital lengths of stay, nurses' administrative time, drug usage, and radiology. Potential safety benefits. There is a focus on computerized provider order entry, or CPOE, when electronic medical records are discussed in terms of safety. In an inpatient setting, 2/3 of CPOE benefits are attributable to drug adverse events that occur in patients 65 and older. In an ambulatory setting, the authors estimate that CPOE could save $3.5 billion. Potential health benefits of electronic medical record systems. The authors estimate that using electronic medical record systems with reminders for preventative care will increase spending modestly, but this cost will come with significant health benefits. The authors believe that electronic medical record systems are an essential aspect of chronic disease management programs, and they estimated that potential combined savings could be $147 billion per year if 100% of chronic disease patients participated in such programs. Cost and net savings of electronic medical record systems. The estimates for cost of 90% adoption of electronic medical record systems for hospitals is a cumulative $98 billion. The estimates for cost of 90% adoption of electronic medical record systems by physicians is a cumulative $17.2 billion. Looking at the graph on the right, the solid black line shows a cumulative net savings of $371 billion in inpatient facilities over a 15-year period. The solid gray line shows a steady yearly average increase in savings. Takeaway and questions. The authors use many resources such as statistical methods, surveys, and databases to extrapolate and provide information. The authors also looked at other industries who did well with IT, and used that information to estimate healthcare savings with EMR adoption. The authors estimated $77 billion in savings after 15-year period at 90% adoption of electronic medical record systems. When discussing EMR safety and health benefits, the authors looked at aspects such as CPOE, HIT, and chronic disease management. The authors used many estimates throughout the paper. Do you think there may be any issues with their estimates? This paper was published in 2005. How do you think the savings estimates made by the authors would compare to the actual savings from EMR adoption today? This is the reference to the reading, and this is the end of the presentation. Please leave comments or questions in the forum. Thank you for watching.